In this video, we are going to show you the normal setup of the sedatives and paralyzing agents and vasopressors that you may find in our ICU patients. So in here, you've got our central line is a 3 lumen. Most commonly, you have a 5 lumen, so 2 extra ports. We've got the propofol and our fentanyl going in the same line, they're compatible. The atracurium and the noradrenaline. So this will be our propofol. This is not normally how it looks like. The propofol bottle looks like this, is a white solution. And like any other drug, it must be checked by 2 nurses and signed for in our drug charts. So is delivered via a giving set and an infusion pump, like so. All our drugs, they're delivered using our guardrails, the critical care guardrails. So this is an example of what a propofol infusion pump might look like. And the propofol is our sedative. If you have a look here, so this is our label for our line. So, and it's got an expiry date. So initially, you just put the date that where you set the infusion line up on the 1st, for example. And if it's a propofol line, it should last you 24 hours. For Atrapid, the line will also only last for 24 hours, but all the other lines should last you 72 hours. So we've got the noradrenaline, for example. It was set up on the 10th, and it will be changed on the 13th. So propofol is our sedative. We've got our fentanyl here that goes into a syringe driver. This is our opioid, and it should last you 3 days, the line. All the lines can last up to 3 days. However, the drugs will last you only 24 hours, all of them. The noradrenaline goes into an infusion pump, and our atracurium, which is a paralyzing agent. Your patient might or might not be paralyzed. In this video, we're going to show you how to change a propofol bottle and a noradrenaline bag when they're almost running out. So we've got our propofol infusion, which will look a little different from what it looks here. So this is how it look like. It will look like a bottle and reverse, and is a white solution. But for the purposes of this video, we're going to consider that this is our propofol. So when it's about to run out, your syringe, your infusion pump will tell you so. So what we do is we literally grab the bottle. We'll make sure that your chamber's got solution in it, at least the amount that you're seeing here. And we're just going to quickly change it and adapt a new one using a aseptic non-touch technique, and then hang it back. So we're going to make sure that there's no air coming into our system. But if you've got a half full chamber, that you should be okay. So once you're done with that, we're going to change our VTBI, our volume to be infused, by pressing the button menu, and then we'll press enter. And we're going to increase. So if your bottle is running out, you should have something around 10 mils. So we're going to increase to the amount that we just put up. So in this case, it will be 100 mils, but because I want to have a lot of time to change my bottle and prevent it from running out and getting air in my line, I'm only going to set up at 90 mils or even 85. So I'm going to press OK, and that's you done. If you're needing to change your noradrenaline bag, it will be a similar procedure. Just bear in mind that, again, your drug will last you 24 hours. Your giving set will last you 72. If you need to change your giving set, then we need to do what we call double pumping. And for that, you'll need a senior nurse with you to help you. If you just need to change your bag and not the set, we're going to grab the bag. Again, make sure you've got fluid in your chamber and quickly swap from one to the new one using an aseptic non-touch technique, and making sure you don't get air into your line. So once you're done with that, again, we're going to change our VTBI and be very, very careful with this, because you definitely don't want any air going into your line, because they'll have a very, very, well, they might have a dramatic effect on your patient's blood pressure. So we're going to press the button menu and then press enter. In this case, again, you have a low volume here, so we're going to increase, and I would suggest you set up about 85 mils at least, to give you plenty of time to get another bag ready. And you press OK, and that's you done.